Hello everybody, Dr. Conger here. And today I want to encourage you with some good news. You know, there's a lot of news around us and it doesn't seem like we're getting much of the good news. So today I want to encourage you with some good news. It's time to let go and eliminate the fears in your life and take back control over your health and your family's health and your life. You know, today what I want to do is I want to do that by helping you get some clarity, separating fact from fiction. You know, knowledge is power. Would you agree? And when you have power, you have peace in your life. So today, what I'm going to do is go over some facts to help you get the real knowledge so you can have power back over your life again. You know, most of you don't know this, but it's been almost a month since the director for the World Health Organization, Dr. Tedros, declared the COVID-19 a pandemic. And he instructed all the heads of countries to put shelter in place. Well, what most of you don't know is that his decision to do that was based on an epidemiologist by the name of Neil Ferguson, who made and created a model that originally said that 2.2 million people were going to die from this virus in the United States and that 500,000 people were going to die in the UK. Pretty big numbers, would you agree? Absolutely. That was the same thing that Professor Sinatra Gupta thought, who was also leading a research group there in the UK at the Oxford Medical School. And when she looked at his numbers, she thought to herself, you know what, these numbers just don't make sense to me. So she went to Neil Ferguson and she said, I want you to recalculate your numbers because they're not making any sense. So luckily, he went back and recalculated his numbers. And as a result of that, 2 weeks later, on March the 26th, he rescinded or he drastically downgraded his original projections to 100,000 deaths in the United States and 20,000 deaths in the UK. That's a huge difference, would you agree? Absolutely. Well, that same day, on March 26th, our President of the United States, Donald Trump, held a press conference with his medical task force, COVID-19 task force. And the two doctors, I don't know if you notice that anytime he does these press conferences, the doctors that are there by his side helping him are Dr. Anthony Fauci, who is his lead medical doctor, and Dr. Deborah Bricks. She's the response coordinator. And they seem to be reporting very regularly with him. Well, on that day, Dr. Anthony Fauci also had put an article into the New England Journal of Medicine, which is the top journal in the world. And in his article, I have it right here, Dr. Fauci gave us an update on the virus. Basically what he said in his article, Dr. Fauci said that it looks like the COVID patients are predominantly in the elderly who have underlying conditions. He also said that it looked like the mortality rate is probably going to be around 1.4%. But he continued to say that when you include all of the people that have been exposed to the virus who either didn't know they were exposed to it or maybe they had minimal symptoms, when you include those numbers, he said that the morbidity rate, the comorbidity rate, is actually quite much lower than that. He went on to say that ultimately this virus might be something more like a severe flu season as compared to some of the diseases that we've seen before, like SARS or MERS, where the actual fatality rates could be were as high as 9% or 10%, and in some areas even 36%. So basically, essentially what he was saying there is that the mortality rate of this flu is going to be radically less than they originally feared. He went on to give an example of China, where the mortality rate they came to find out, as the numbers came out, around 1.4%. And he went on to say, again, because we don't have all of the people included in the study that maybe had been exposed to the virus, which they're telling us now that maybe 25% or even upwards of 50% of people are exposed to the virus and don't even realize that they have it. He said that their fatality rate is probably going to come in more like something less than 1%. So here we have a doctor who is making all of the decisions in our country right now, saying that it looks like we're having more of a severe seasonal flu than an actual pandemic, where we had to lock ourselves down, shut our country down, lock ourselves away, and crash our economy. You know, every life is an important life. But when we're talking about a flu that's less than 1% fatality, and as compared to other flus that we've had in the past, where we never shut our country down, you know, we've all bought into, you know, this panic, and they keep pushing the panic button, when in reality, you know, we're talking about a flu that is probably going to be less than 1% fatality. So buyer beware, you know, careful what you buy into. You don't want to buy into all the panic that the media is putting out there for you. You want to be careful and look at the facts. Look at doctors, what they're telling us. Look at the epidemiologists. Look at the scientists and the infectious experts to get the true knowledge about this virus. Now, I was excited when I saw Dr. Deborah Birx admonish the media for the fear-mongering that they've been doing. Dr. Birx, you know, when the journalists start questioning her about all of the cases that we're expecting, you know, they were putting in really high numbers, like saying, you know, we're going to see 20% fatalities in America. We're going to see, you know, much higher numbers. I loved her response because she turned to them right away and she said, you know, those are some really scary, scary numbers, but as the data is coming in, we don't have any data that supports those large numbers. And she went on to say to them, you know, you're scaring the public with this large numbers that you keep reporting, but there's no data to support that. And so I was really proud of her that she actually called them out on that, because there's a lot of people that are really scared right now, and they really don't need to be. Now, she also went on to tell them, look, because they were trying to say we don't have enough ventilators, we don't have enough hospital beds, and she said, look, that's not true. There's plenty of beds, we have plenty of ventilators. In fact, they're finding that they have respiratory drugs now that actually, when the patients who are on ventilators take them, it actually enables them to get off those ventilators within 6 to 8 hours. And the medical doctors that are using these drugs are saying they're almost getting 100% results. Like, for example, I saw this one article with Dr. Vladimir Zelenko. He treated 699 patients, and of those 699, he had 100% success rate. So all of this fear mongering and fearful fear tactics that these irresponsible journalists, really I call them, are putting on the television stations, they really need to get the facts themselves, and they need to, reconsider their approach. I know they're trying to get eyeballs on their stations, but really, I think if they started reporting on the positive stories, I think they'd get a lot more eyeballs on their stations. So there are some amazing numbers about that are coming out right now, and that's what I want to share with you. In order to do that, the first thing we have to do, though, is put things into perspective. When we look at our country, there's approximately 330 million people in our country. And on average, about 10% of our population every single year will get the flu and has gotten the flu for decades. So what that means is that 33 million people approximately will get the flu, and approximately 36,000 will end up in fatalities, a very small percentage. It could be a little less than that, it could be 10,000, it could be as high as 60,000. That's what we've seen. That's been the data that we've collected for years. The United States right now, let's talk about the facts. Right now, I looked it up a couple days ago, and in the United States right now, they are saying that we've had approximately 366,000 cases. So if you compare that to years prior, what does that tell us? That we have upwards of 33 million cases, 10% of the population. We're not even close to that yet. In the United States, we've had a little under 11,000 deaths. And again, I haven't checked this today. This was 2 days ago. And so 11,000 is not 36,000. It's not even 60,000. Here in California, we have 40 million people. We've had 16,000 cases. 400 of those have been deaths. So that means that 15,600 people that had the case actually survived and recovered from the virus, from COVID. Now, China is back in the workforce, and so we're getting a lot of their numbers coming out right now. China says that their fatality rate is 1.4%. Again, if you add in, the people that haven't reported, it's probably much less than that, according to Dr. Fauci. But in China, they're reporting almost 83,000 cases. And of those 83,000 cases, they're telling us that 76,571 of those people have recovered. That's a 93% recovery rate. And again, if you add back in all the people, maybe another 25% of their population that had it and had no symptoms, of course, that 93% is probably something much higher. Who knows? Might be 95%, 98%. That doesn't sound like a pandemic to me. Because when I look back and I think about the pandemic flu that we had in the world in 1918, and if you look those numbers up, there was between 50 to 100 million people that actually died in that flu season. That was a true pandemic. So what's the big issue? What's the big deal with Corona? Well, like we know, every year we get the seasonal flu, right? We might catch a cold, and we're sick for a couple of days, and then we recover. And then a small population, maybe, like we said, less than 1%, will actually die from it. Not the general population, but a small portion of the population. When that population passes away, most of them, when you look at the statistics, had underlying conditions that compromise their immune system. So why is this flu so different? Why are they saying that this flu is so different when we, for decades and decades, have had a flu season every year? And the reason is because this is the first virus that has never been in the human population before. In other words, none of us have actually been exposed to this particular virus. So as a result of that, there's probably going to be a lot more of us that are going to come down with the flu, because this is how our body builds its immune system. We have a virus that enters the body. Most of us have been exposed to trillions of viruses. So this happens all the time and we don't even know it. Once we're exposed to a virus, our immune system goes to work. It builds up antibodies, hopefully, if we have a strong immune system. And then now we have a lifetime immunity to that virus. Every symptom the body has is your body doing the right thing at the right time. Why do you get sick when a virus comes around? Because that's your body doing the right thing. It's trying to protect you. It's trying to build up its immunity. That's what it has to do. And so getting the flu is not a terrible thing unless you've neglected your health. Because really what they're telling us about this virus, what the experts are telling us, is that the real issue is not being scared about getting sick or about sickness. The real issue is about your underlying health and your immune system. How strong is your immune system? Because the people with strong immune systems are not the ones that are coming out in the numbers. It's people who have underlying health conditions and who have a weakened immune system. So there is a small population that will actually die every year with this, probably a 0.1%. Dr. Fauci says this year it's going to be a little higher, probably. It's going to be more like a severe flu season, is what he's guesstimating now, what they've downgraded this to. And who's going to be the people that are going to be dying from this? The same people that die every year. The same people that have that are in nursing homes, that are in intensive care units, who have underlying conditions. Now, I have a report that they printed out in New York City. It's actually the data summary of the deaths in that city so far. Now, this was as of April the 1st. As of April the 1st, this report says that there were 1,374 people that had died at that point. What they're saying is from the COVID. That's what they're saying, that these people died from. Now, what they're also showing us here is the underlying cases that the people had that actually weakened their immune system, that led to them having a weak immune system. Because if you have a problem in your body already that is weakening that immune system, when that virus comes around, your body only has so much immune system. So now it's got an extra burden to try to battle that, when it's already lacking in an immune system that it doesn't have to do that battle. So what do they consider is an underlying condition? Well, we're going to go over that here in just a moment, but let's look at these numbers. 1,374 deaths, 1,356 of them had an underlying condition, right? Meaning that these people had a weakened immune system. Now, what is their definition of underlying conditions? Well, here it says an underlying condition would be something like diabetes, cancer. Certainly, if you have cancer, you have a weakened immune system. Heart disease, chronic respiratory diseases like what? Well, maybe the person had bronchitis or pneumonia, or maybe they had asthma, or maybe they had some kind of upper respiratory infection. people that have liver conditions, it says. Liver conditions, autoimmune diseases, ulcerative colitis, colon problems, kidney problems, which could be in that autoimmune category. So the majority of the people in this report that they're totaling up as their fatalities for the COVID virus, the majority of them already had underlying conditions and a weakened immune system. So if we look at Italy now, Italy also had, there was an article about Italy's outcomes. This article says that 99% of those who died from the virus actually had other illnesses, 99%. So you see, these are the facts. This is the data that's coming out of this virus. So what I want you to remember is this. Here's the good news. The good news is that viruses are opportunistic, meaning they have to find a host in order for them to thrive and live in your body. They have to find a body that is weakened and broken down in order for them to take a stronghold in you. In other words, 98.8% of these people and 99% of the people in Italy did just fine. In other words, if you're in that 98.8%, you have a strong chance of going right through this. We'll all probably get this virus. We'll all probably be exposed to it. Me and my family, we haven't had any symptoms, but we have a strong immune system, but we could have been exposed to the virus as well. I've been working every day with patients and trying to help our patients stay healthy and strong, going shopping. You know, the viruses are part of our everyday life. We all have viruses in us. The majority of us probably will have no or very little symptoms. And if we do have symptoms, the few percentages that do have issues, that's what we have crisis care for. The doctors are going to be able to put you on a ventilator, hopefully get those healthy, chloroquine and the zinc tablets that they give you with that. They've had great success with that, and hopefully you'll get through that crisis. For the average person, you're probably not going to be impacted by this. And then, of course, there's going to be that small percentage, those people that haven't taken care of their health, that have neglected their health, who unfortunately got caught with their pants down here. And as a result of that, they're the ones that are probably going to die from this virus. I always use the analogy, you can smoke a cigarette today and tomorrow you get up, you'll be fine, right? But if you keep doing that habit every day for 10, 15, 20 years, one day you're going to wake up and say, how did I get this emphysema? Well, you've been a smoker your entire life. Or, you can eat that brownie or eat that donut today, and tomorrow you'll think you're just fine, but it takes 20 years for cancer, for heart disease, for all of the chronic illnesses that we know is what's killing so many people in our country. 5 out of 6 people will die from heart disease and cancer. So the real issue isn't the virus, guys. The real issue is, are you taking care of your health? So whether or not you get this, the severity of it is going to depend on your health and your immune system. So the good news is that you have power over this. Number one, take care of your health. And there are extremely easy ways that you can get rid of these underlying conditions so they never develop in your body to begin with. And there are extremely easy ways that you can build a fierce immune system. You know, scientists and researchers have already discovered that 98% of disease is caused by inflammation. It's not genetics. Only 2% of disease is caused by genetics. Researchers are telling us that 98% of disease is caused by inflammation. So that's some more good news, because the good news is that we have power over that. You have power over eating healthy foods. You have power over not eating sugar and reversing your diabetes. You have power over taking the right supplements, vitamin D, whatever it is, to strengthen your immune system, to strengthen your health. You have power over that. You have power to go outside and exercise. You have power over watching the toxins that go in your body. This upcoming weekend, I want everybody to go into their pantries and pull out those, what I call food-like substances that you're eating. You know, our bodies are alive. Our bodies need live food. And in order for our bodies to get healthy and reduce that inflammation, the first thing you have to do is stop it. So the 4 things that you can do to stop that is stop eating sugar. Sugar reduces our immune system for up to 8 hours every time we eat it. You know, you ever notice around the holidays, everybody's getting run down and sick and the flu and all these different things. Well, what do we eat all the way from Halloween all the way into Valentine's Day? You know, so no wonder people's you know, their immune system is lowered and they're getting sick. So eliminate the sugar, eliminate the bad fats, eliminate toxins, eliminate you know, the cardboard food, eliminate anything that's acidic. So the first step is stop making it. Now this next step is very important. You want to make sure you heal your body. Now how do you heal your body? You give your body fuel, right? If you owned a Jaguar, what kind of fuel would you put into that? Or a sports car, what kind of fuel would you put? High premium fuel, wouldn't you? Well, your body is your greatest asset. Stop putting garbage in it. You know, you only get one body, like my mother told me when I was a little girl. You only get one body, so you have to protect that body. It's your best friend. How would you treat your best friend, right? You treat it good. So this is your body. Do good things for your body. The other thing that you can do is start eating healthy fats. That puts out the fire. The inflammation in the body is like a fire. So olive oil, start eating avocados. What else? Coconut oil is a healthy food. Organic grass-fed beef. Start eating healthy meats. Things that don't have toxins. I always say it's not about you know, the piece of meat that you're buying. It's about what did that animal eat before I'm eating it. So make sure that when you put things in your mouth, they're healthy things, and lots and lots of vegetables. Vegetables have phytonutrients in them. You know, low glycemic fruit like berries. Blueberries are high antioxidant foods. Very important that you put these high density nutrient foods in your body. Your body needs good fuel in order for your body to be healthy, to heal, and to be healthy and to be well. Now, we call these the 5 essentials. And the first essential that I haven't talked about yet is the mind. Now, believe it or not, your mind has a lot to do with how healthy you are. The fact that you're on this video here today trying to get the information, that's great. That's getting a max mind on. The next thing I want you to think about, though, is I want you to put a guard at the door. Turn off that media, that constant negative news, CNN, all the other TV stations that are posting all the deaths and people wearing masks and you know, our country is dying message. Turn all that off, because when you worry, you actually cause your cortisol levels to go up. And when your cortisol levels go up, guess what goes down? your immune system. So by watching that junk, you're actually making yourself sick. So turn it off. Turn it off. Go outside. Go, take a walk with your dog, and then do some kind of exercise that increases, your blood. Make sure you're doing something that's vigorous and that's really going to increase, the blood flow in your whole body. This also increases your body temperature, which kills off viruses. So see, the good news, you do have the power. You do have what you need to take back control over your health and your life. Look, guys, the most important thing is that we keep you, the host, strong. Now that you know the difference between fact and fiction, you can see that this is not an outside-in problem. This is all about your immune system and how your immune system is working. So you can wash your hands, you can cover your face with a mask, you can practice social distancing, but the one thing you don't want to distance yourself from is your chiropractor. Our office is open, and it has been open. And the reason why it's been open is because, number one, what we do, chiropractic works. And because they said that we are essential services. Santa Clara County is, right now, we're shelter in place. And there's a lot of things that they have shut down. But the one thing they're not shutting down is our ability to go grocery shopping and to visit our essential healthcare services. Chiropractic is a healthcare service that's essential. And the reason why it's essential is because it is essential to our immune system. It's essential to our respiratory system. It's essential to all of the functions in our body, because what controls all function in your body? Your brain and spinal cord, right? And so that's why they have kept our offices open, because they know it works. And it goes back to the pandemic flu of 1918, where chiropractic actually saved that era. And so our office has been open, and it continues to be open. So if you haven't already been to your chiropractor, and if you're a patient of ours and you haven't already been in, it's so important that you make sure that you make it in. Who's responsible for your health? You are. And just understand, no one's coming to save you, right? So the most important thing, the one thing that you don't want to distance yourself from is the very thing, the one place that's going to keep you and your family healthy. So remember, the greatest doctor ever is right inside of you. And if you take care of your body, if you take care of your health, your body has the most amazing power to heal and be well. And now that you know the truth about Corona, the question is, what are you going to do about it? This is an immune system problem. This isn't the boogeyman coming to get you. This is all about how healthy you keep your body. So now that you know the truth, the facts, not the fiction, now you owe it to yourself to take care of yourself. You've got the power. Now use it.